Interstitial lung diseases are a challenging and a diverse group of inflammatory and fibrotic lung disorders that are often associated with substantial morbidity and mortality. Now, many of these diseases, they evolve from an initial inflammatory process involving the lung interstitium with or without the involvement of lung vasculature and even the airways. Hello and welcome to Medical Dialogues Journal Club, your daily dose of health and medical news. I am Dr. Nandita Mohan, and today I'm going to talk about the presence of obstructive sleep apnea in Indian population, as there is lack of data on sleep breathing disorders in the interstitial lung disease patients from India. The obstructive sleep apnea, as we all know it, is commonly found in interstitial lung diseases with overall incidence rate varying from 17 to 88%. The morbidity and mortality of obstructive sleep apnea are quite high when it occurs with chronic respiratory diseases like interstitial lung disease themselves. The present study is published in the Journal of the Associations of Physicians of India. It aimed to assess the occurrence of obstructive sleep apnea in interstitial lung disease patients and also its correlation with other parameters. It is a prospective observational study of 41 interstitial lung disease patients of 1 year duration. All the patients, they underwent a detailed clinical examination, radiological evaluation, lab investigations, and also type 1 diagnostic polysomnography according to the American Academy of Sleep Medicine guidelines. The mean age was 55, with 73% being female. The mean BMI of 28.6 with dyspnea and cough were the common symptoms. The obstructive sleep apnea was seen in 78% of the patients with 24 females. The apnea-hypopnea index showed significant positive correlation with BMI, while negative correlation with forced expiratory volume or the forced vital capacity percentage. Therefore, it was thence concluded that the prevalence of obstructive sleep apnea is common in North Indian interstitial lung disease patients. So, polysomnography should be done in all the patients with interstitial lung diseases whenever feasible for an early diagnosis and the treatment of obstructive sleep apnea, as the coexisting of both will further decrease the quality of life and also increase the morbidity in this chronic progressive lung disease. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.